Now, in this lecture, we're going to look at mechanisms of normal labor. Now, labor can be defined as regular progressive uterine contractions that result in enforcement and dilatation of the cervix with descent. Now, it has features. So, what are the features you should look at when you're saying this is a normal labor? We have presentation should be cephalic. The lie should be longitudinal when you are doing Leopold maneuver. The position should be occipital anterior or right, left occipital anterior. It can be right occipital anterior, it can be left occipital anterior. So the attitude should be a full flexion, and then the presenting part should be the vertex. Then the term of labor should be at term. The beginning of that 8th week and the end of 41st week. All these are the features of normal labor, or we can say normal labor lies within these features. So factors affecting normal labor, they include the passenger, the placenta and the fetus are the passengers, and then the passage is the birth canal through the pelvis, and then we have the power, the primary and the secondary. When we say primary power is when we have the natural rhythmic contractions of the uterine. But when we have secondary, there is a maternal effort in conjunction with the primary power. The psychology, that's the maternal mentality and the mood. Then the position of the mother, This is the position where the mother is lying. So we can have preterm, anything that is deviating from these features. It can be a preterm labor where it begins prior to 37 weeks, term, the end of that 7 weeks to the beginning of 42nd week, and then post-term after 42 weeks. Then the stages of labor are classified into 4. We have the first stage of labor, which has the latent and the active. The first stage of labor is from the beginning of labor to the full dilatation of the cervix. When the cervix is fully dilated, is 10 centimeters. So latent phase of labor is 0 to 3 centimeters. And then active phase of first stage of labor is 4 to 10 centimeters dilation of the cervix. The second stage of labor is from the time we have 10 centimeter dilation of the cervix to the delivery of the fetus. And it usually takes 2 hours. Then for multiple hours, it can take 1 hour. And the third stage of labor is when from the time you deliver the placenta and the membrane. So the maximum time is 30 minutes, but it can reduce into 5 to 10 minutes when you use the active management of third stage of labor. Then we have the fourth stage of labor, that is from the end of the delivery of the placenta and the membranes. When you observe the mother, you observe the baby from the first to the 4th hour after delivery. Now, the mechanisms of labor, these are the movements, cardinal movements during labor, and they lead to changes in position of the fetal head during the passage through of the passenger through the passage. This one we can't forget. So we have the engagement, we have descent, we have flexion, we have internal rotation, extension, external rotation, and expulsion. For engagement is the passage of the widest diameter of the presenting part to level below the plane of the pelvic inlet. So when it has gone below the plane of the pelvic rim, it occurs earlier in nulliparous, around 36 weeks. Multiparous women, it descends late, perhaps during the onset of labor. And then descent is the downward passage of the presenting part in relation to interspinous diameter. Remember, this is the diameter that is 10 centimeters. And we spoke about it in our lecture of the maternal pelvis and the fetal head diameters. All these So the descent is in relation to these. Most obstetricians can go to -2 to +2. Some can say -3 to +3, or you can go up to 5. And then the flexion of the head of the fetus is when the fetus meets the floor of the pelvis, and then the head is flexed, and then the chin touches the chest. These are full or complete flexion. And then we have internal rotation of the head. So the head rotates internally now to face downward. And then this extension when after it has passed through these and is at the external, the inferior margin of the symphysis pupil, the face sweeps on the perineum. Then we have the external rotation or restitution where the head returns laterally. Then we have expulsion where the anterior shoulder is delivered first and then the posterior shoulder. So this is the mechanisms of labor and the factors affecting it. Until the next time, let us meet. Thank you.